Hello. Today I'm going to talk about discharge teaching or discharge education. Discharge planning is one of the important components of a nursing care plan, and you start discharge planning as soon as the patient is admitted in your floor. And along the way, you complete the discharge planning, and then by the time the patient is ready to be discharged, the doctor signs the discharge papers for your patient, and then you can start your discharge teaching to your patient before you let them go out of the facility. Um, there are a couple of components of a discharge teaching. One would be as soon as I discharge my patient, I'm going to be talking all these components. One would be the diet, because my patient today had heart disease or myocardial infarction. My discharge teaching would focus on her current condition. And as far as diet is concerned, I'm gonna talk to her about her current diet that the doctor orders. She will put on a cardiac diet or on a heart healthy diet, and that includes lean meat, fruit, and vegetables. He is also going to be on low sodium diet and a low cholesterol diet. Since the patient has history of diabetes or type 2 diabetes, she is also going to be on a low sugar diet to manage her diabetes. If the patient is smoking, I'm going to teach her on ways and how to to quit smoking. And if the patient is also actively drinking alcohol, I'm gonna advise her or educate her on the limitations in the consumption of alcohol. For the first at least 4 to 6 weeks, she can't take any alcohol, and if she has to after that period of time, then she has to limit her alcohol consumption, so not to run the risk of having complications again with her heart ailment. I'm also going to be educating her on the management of stress, management of her stress, which is one factor of heart ailment as well. Keep herself busy so she doesn't stress, or if she's not able to manage her stress very well, she can always call the provider to get a referral to a counselor. Now, if the patient has access to the internet, or if the patient has a smartphone, or she knows how to, she's tech savvy, she can actually go to choosemyplate.gov to create a healthy meal plan. And as well, she can download apps on her cell phone where she can input her caloric intake and to be able to control it, and as well as track her physical activity or her exercise plan as well. Now I'm gonna go over as well to her the activities that she can do after she gets discharged from the hospital. As much as possible in the next 4 to 6 weeks, she has to avoid lifting heavy materials, or doing some strenuous activities. If she can just go easy on activities, at least for, like I said, the next 4 to 6 weeks. I would recommend that she would take some rest in the afternoon, at least 30 minutes, and not to over nap, because she also needs some good amount of rest in the evening and good amount of sleep. I'd recommend her to go to bed early and get plenty of sleep. Hydration also is very important, so she has to drink as much as fluids that she can have. She can start on a low impact exercise after like 6 weeks or 4 to 6 weeks, and she can start by walking, and maybe later on she can increase her intensity if she can tolerate it, and make sure to take some rest if she feels uncomfortable. Part of the discharge teaching is also going through the medications that are ordered by the doctor. Um, there's gonna be a list of medications that she's gonna be taking at home, or if the doctor has prescriptions for her to take with her, so she can get through any drugstore that's close to her. So I'm also gonna give it to her. I'm gonna go through them one by one, and of course educate her on taking the medications as prescribed. A lot of the medications for patients who had myocardial infarctions or heart attack would be blood thinners, beta blockers, or ACE inhibitors. So I'm gonna go through each of them and walk through on the possible side effects that she might feel, and to report to the doctor if there's any like adverse event that she will have while taking the medication. I'm also going to educate her on the importance of taking the diabetic medication regularly as prescribed by the physician. I'm also going to educate her on regularly taking the cholesterol lowering pills as prescribed by the prescription. A lot of this are statins, and to make sure to take them on time. And at the same time, most importantly, I'm gonna educate her on not to stop the medication without talking to her provider. And like I said earlier, she may report, importantly, that she would report any adverse events or negative side effects of the medications, especially signs of bleeding, hypotension, or any allergic reactions. The patient also has going to be educating her as well on the importance of monitoring her blood pressure regularly or daily. I'm going to also educate on the importance of monitoring her weight, and um, tell her to keep a healthy weight, and at the same time to monitor her blood sugar regularly as well. But if the patient hasn't been checking her blood pressure before, then during the course of time when she's in the hospital, I'm gonna um, I'm gonna refer her to the diabetic educator, and then so they can teach her how to use a blood glucometer, and then do some teach back um, to assess that she knows how to check her sugar at home, her glucose at home. Um, Another component of the discharge teaching would be to educate her when to call the provider, or if she can call the provider, she can call 911 right away if there's a need for her for quick assistance. If she feels pain, pressure, tightness, or heaviness in her chest, neck, or jaw, if she's having shortness of breath, if she has gas pains or indigestion, if she experienced numbness in her arms or sweaty, or if she lose color, like she becomes paler, or lose color on her extremities or on her skin, if she feels lightheaded, and if she feels like the medicine does not help her ease her symptoms. So she has to call the provider right away or call 911 so she can be taken to the hospital or the emergency department right away. And another important component of a discharge teaching would be to educate her as to when she has to visit her doctor or follow up. Make sure that she has to come to go to the doctor's clinic for follow up as prescribed or as scheduled. Normally, usually it's like a week or 2 weeks after she gets discharged, and it depends on the prescription, or when is the availability of the doctor, or when the doctor would want to see her. So if the patient also shows a need for help for, especially with regards to medical or financial needs, I want to make sure that I'm going to refer her to the social worker, and I'm going to have also the social worker talk to her. And at the same time, if there's a need also for rehab, or if the patient would want to be put in home health. She will be assessed if she can be put in home health, and then if she is, then the proper referral to home health agency would also be done upon discharge. And to wrap it up, I'm gonna have to ask the patient if she has any questions with her discharge instructions, and if she has, and I'm gonna try to answer her questions. And I think that's about it. Thank you very much.